Heroes can be defined in all sorts of ways, from the superheroes we see in movies and comic books, to our military or first responders, to a parent or grandparent we've looked up to all our lives, and ordinary people who rise above to do the extraordinary to better our society. But the COVID-19 pandemic has given rise to a new kind of hero, the long-term care hero. Long before the first case of COVID-19 was confirmed in Pennsylvania, you've always been there, providing compassionate care to thousands of seniors in Pennsylvania's long-term care communities. And since the early days of the COVID-19 crisis, long-term care workers across the Commonwealth have exemplified what it means to be extraordinary.
When COVID-19 first, really came to the United States, I think, similarly to other viruses like COVID-19, I think people falsely thought maybe we wouldn't be affected by COVID-19. So once they realized that it was rapidly spreading, I think fear really was instilled in a lot of people, especially in our industry, because we care for the most vulnerable population.
In the beginning, some staff were frightened. Other staff hung right in there with us. The nursing leadership team right away began education with all the staff on all shifts. The leadership team was here morning and night to make sure that staff understood and the communication was taken down to the staff level.
We sent out all the information to the family members. The staff just jumped right in. Nobody had a hesitation other than to say we need to protect the residents in the community. So everybody came together. We made sure that we spoke to all the residents and the family members, and really it was just about the safety of others.
Trying to make sure that we're up to date with the latest information and making sure that the residents are also understanding what we're trying to do to keep them safe, because the residents are also all watching the news, so they're seeing things, they're seeing numbers, they're seeing what's happening in other nursing homes, and trying to allay their fears and allay the fears of the families has been a pretty big challenge, but I definitely think that our team has pulled together beautifully and handled that very well.
Faced with caring for a population that has been hardest hit by the novel virus, you've doubled down on your commitment to caring for and protecting those in need. It hasn't been easy, but your relentless spirit never wavered. Your resilience and courage in the face of adversity has inspired all of us.
The fact that the residents couldn't have visitors like they had before, we noticed an increase in residents' depression, loneliness. So the staff really had to take over for the family members and be the one that was there with the resident and comforting them during those times.
My campus specifically was affected by a COVID-19 outbreak. That was something that I don't think that anybody could have ever expected, that it would be the way that it was. And our staff members sat alongside of many of our residents, who had COVID-19. And we didn't know at that time whether they were going to make it or not.
I mean, every day they come to work. I mean, they take away from their own family to come here, not, worrying about the chance that we're going to catch it and bring it home. We all have kids, and with everything changing, and it's been difficult, but they've all gone above and beyond.
Of course, activities has changed greatly, which put the activity staff in a vulnerable position with trying to find things to keep people's minds active and take some of the worry off and relieve some of the fact that they weren't able to see their relatives and things. So we were kind of filling in for the missing relatives that they weren't seeing.
I know that I tell people that I feel as if our residents are my adopted grandparents, and I love them and care for them in that way. And I know that all of my staff members who are in the building would tell you the exact same thing.
When we couldn't visit our loved ones, you cared for our parents, our grandparents, our friends, and our neighbors. You cared for them and protected them as if they were your own, putting their safety and their well-being above yours. Because of your hard work and sacrifice, thousands of Pennsylvania's long-term care residents are now beating the odds.
I would want the general public to know that healthcare obviously is a career choice, that many people choose to make, but what they never assume is that they're going to go through a pandemic.
The staff that's working in our building and buildings across the country are definitely dedicated employees. There is no way anyone would want to go through this without having that dedication, that care and concern for the residents that we serve.
We had staff working 12, 15-hour shifts, spending one-on-one time with our residents who had COVID.
The people who work here are heroes. We have the signs everywhere in all the yards of every community that you drive by, and it's 100% true. It's not something that you just say off the cuff, because they've really dedicated their lives to taking care of people in a situation that they've never dealt with before, and I know that they're scared, and they've been such warriors to go through it.
It really is truly remarkable to see, it really is truly remarkable to see the commitment of our staff, because everybody comes to work and everybody has a fear in the back of their head of the virus, and their grandparents at home or their mom who has cancer, and they still continue to commit and to show up and to care for our residents, and it's really just truly awesome to work alongside of these people. So, we're forever grateful to our team.
Your commitment and courage to our communities in the face of such danger will be admired for years to come. And I, for one, am so proud. Thank you.
I have never been prouder to be associated with this profession in my life, and I've been involved with this profession for over 40 years. Thanks to all of you for everything you do every day. Congratulations, and keep up the good work.
I am also humbled by the sacrifices that you have made and continue to make to protect and care for those who need us the most during this time.
I couldn't thank you enough. I couldn't be prouder to be part of this industry. And my heart goes out to you. Thank you for everything you've done and continue to do every day.
Just want to say how much respect, admiration, and appreciation I have for all our frontline heroes in all of our facilities throughout Pennsylvania. Thank you for everything you do.
I do believe, though, if there's one thing that we can point to that's been a very positive development throughout the past 7 or 8 months, it's the fact that the world outside of our sector has seen the true dedication that you bring to your work every day in helping to safeguard the lives of residents, patients, and staff.
But let me offer a sincere and heartfelt thank you for all that you've done and all that you continue to do.
I'm here today to give a big shout out to all of our frontline healthcare heroes with ProMedica Senior Care and all of those throughout Pennsylvania Healthcare Association. Thank you for what you do. God bless. Take care.
So I want you to know that I stand with you in this fight, and I'll keep fighting for your facilities, for your residents, and for your workers. Thank you, and God bless your work.
And thanks again for the opportunity to address you and for the essential work that you have done and continue to do for the residents of our Commonwealth. Thank you very much.
In these unprecedented and unconventional times, you are emblematic of what it means to be a hero. On behalf of the entire team at the Pennsylvania Healthcare Association, thank you for your dedication to providing the most compassionate care to our most vulnerable residents.